Welcome to Bariatric Business Accelerator. I'm your host, Karol Clark, and today I'm excited to talk a little bit about some of the developments, the IT developments, technology developments specific to weight loss, tracking your patients' outcomes, and lifestyle medicine, which may or may not be surprised to hear, but I actually work with a lot of obesity medicine and bariatric surgeons who are advancing into the lifestyle medicine arena. So it's going to be an exciting conversation, and I can't wait for you to hear all about it. And today we have someone who has been very integral, not only in the use, but the development of the CORE LMP with a very fresh perspective, and I can't wait to share it with you. My guest today is Deepa Deshmukh, and she is actually a colleague and a friend who I've gotten to know over the past year or so. And she's going to share with us her perspective about software specifically. And I'm just going to dive right in there, Deepa, because you're right here, and I want to make this very impactful. But I'd love for you to tell just a little bit about your background and what prompted you to make a decision to make a software change in terms of care of your patients? Because as we all know, that is not an easy feat.
Thank you, Carol, for having me on your podcast. I've been a dietitian entrenched in public health and in private practice for the last 20 years, and I practice nutrition-focused lifestyle medicine. So over the years, it has become very obvious that it doesn't matter which healthcare practitioner you are. You could be a surgeon, you could be a family practitioner, internal medicine, dietitian, health coach, nurse practitioner, PA. The lifestyle components such as nutrition, movement, stress reduction, abstinence from the addictive substances such as alcohol, smoking, and now food, and having a community support are essential for every patient dealing with any acute and even definitely dealing with chronic conditions, but even for acute health issues. So I wanted to make sure that all these healthcare professionals have a way to start delivering these essential components of lifestyle medicine. And it's another modality because now there is no doubt that this is an evidence-based practice, or these are evidence-based modalities. So I just wanted to make sure that every healthcare professional has access to it.
So that's really important. And tell us a little bit about the CORE LMP, your involvement, and how it does help all these different types of practitioners not only prescribe care for their patients, but also track their activities and their behaviors.
Sure. Let's start with the most current trend of GLP-1s, right? For weight loss and diabetes, so on and so forth. So you have a patient who comes to you with a diagnosis of of obesity, and the chronic disease diagnosis is never a one diagnosis. We know it's a multi-component condition. So you have to take into account all those things and not just prescribe just GLP-1. That is how the things were done in the past, but that's exactly what is changing with the rise of lifestyle medicine. So in CORE, what we have is we have a GLP-1 tracking screen for patients. And the CORE platform allows patients and providers to stay compliant with the GLP-1, what is it, like compliant with the prescription, compliant with not only just the GLP-1 medicine prescription, but it also allows the healthcare provider or the doctor to simultaneously assign one or two of these lifestyle medicine prescriptions to aid that process. So we are increasing the patient's chance of weight loss and reduction in their side effects, thus a win-win for the provider and the patient.
Right. I have seen, obviously, and we use in our practice the functionality, so many of the functionalities through this software platform. But talk a little bit about what do you see the benefit to you as a practitioner and your team, as well as the benefit to the patient when you're using the CORE LMP for your I know you're using it for your EMR, your tracking, GLP-1 track, all that in one thing. But how does it really benefit the practitioner? How's it impacted you versus other softwares you've used and your patient?
So in my practice, it's a one-stop shop. I have enough functionalities for my EMR requirements, and on the lifestyle side, I have ability to prescribe 6 pillars of lifestyle medicine, prescribe food prescription or deliver or assign food prescription, assign educational material, and be able to track the utilization of it, hence the compliance to the recommendation. And then this platform has also allowed me to streamline the communication that can happen between me and my patient in between the appointments, because patients initially have a lot of questions about their food and they have slip-offs, and all those things are now getting addressed on a day-to-day basis versus in between appointment, between just seeing the patient for the appointments. So it's the streamlining of it while saving time and improving the workflow efficiencies.
Sure. And how about what's the feedback you're getting from your patients?
Oh, my patients love it. This is the first time they have a platform where they feel that it's easy to use and it's very simple. There are no complicated tracking mechanisms involved. And what they like the most about it is how everything is right then and ability for them to communicate back with us. So as they are slipping off or right after they slip off, they feel that, hey, I'm not alone in this journey. I have somebody who is watching over me or by my side.
I know. I love it. And you can track everything right in their record. It's all HIPAA compliant, back and forth. You even do your visits via video visits, and you can do that right within the platform, correct?
Absolutely. HIPAA compliant telehealth is there. My patient lost 40 pounds just in last 3 to 4 months, literally with the use of one-on-one visits, but in all this in between support and the lifestyle medicine prescriptions that he followed, and the recipes that were given to him, the educational material that was sent to him. And then I had way to track him in terms of how many times he was logging, what his labs were. So it is a beautiful combination of traditional way of doing your clinical work, combining that with this new era of lifestyle medicine.
Right. And you've been instrumental in the development from a clinician's perspective with 20 plus years of experience, which I think really lends it to really the thoroughness within there. There's even educational materials to share that are already pre-populated within the software system, I know, and it ends up being a beautiful thing in terms of that, as well as talk a little bit about the AI integration that you've worked with the development team to weave throughout the CORE LMP platform.
Correct. The AI capabilities obviously make the intake and registration process very efficient, and your admin can save time on that. All the information comes in one place without too many back and forth between the patient and the office. And once the patient is in, what happens is before patient becomes a patient, they come in as a person who are just inquiring about the services, right? So there is
Mm-hmm.
something called lead management. There's a component called patient flow, which allows us to track, hey, who came in as a lead. And that component is very important if you're building your practice. And having it in one place is even more important. So the success journey starts from the first phone call or email or text that your office gets from a person, and
Mm-hmm.
then you nurture that, and then eventually the person becomes your patient. So having that tracking mechanism is extremely important because from the revenue perspective, so that is done, and that's where we have some AI based technology there, and then there are a lot of AI agents embedded to smooth out the workflows, again by to reduce your time and energy doing the extra admin work.
Right. I know when we used that. We've used patient flow for a long time in our practice too. And it's amazing how you can track and really increase the conversion rate. It really maximizes when you get a lead in, being able to communicate with them effectively and help to convert them into a paying patient. And so that aspect, I think, is, like you say, a little bit different for many of the software solutions that you have. I want to just sort of talk a little bit more about the GLP-1 tracking. So many people are prescribing GLP-1s, and I think what part of the beauty is with this system is that you can track your prescriptions, you can track the patient's compliance, you can track any side effects that they're having, you can have that immediate communication. And much of this, I think, is exciting because it's automated. So from your perspective, you still interact with the patient when it's critical, when they have questions and that sort of thing, but you're monitoring this all the way along. And so if there is someone who has side effects, it'll automatically notify you so that you can intervene and that sort of thing. I know that for us and for many practitioners, that's been really helpful because it's been a lacking part for GLP-1 tracking. Have you found practitioners to view that the same way?
Yes, absolutely. The GLP-1 tracker is a very unique one, I would say, because, like I said, along the medication, or like you said, along with the medication, the side effects, the dosage requirements, it also tracks the other components of lifestyle medicine. So it's a beautiful combination of both. And you just have happy patients because at the end of the day, the practice needs to have basic components, right? You need to have billing. CORE has billing capabilities. It has intake and registration. It has very robust EMR functionalities. It has a very robust lifestyle medicine functionalities. So that really, for me at least, it brings everything to home. It ties everything together. So let's say you are an orthopedic surgeon
Mhm.
and you want to prescribe lifestyle medicine as part of your prehab program for best surgery outcomes. You can set up your prehabilitation program as it pertains to including the 6 pillars of lifestyle medicine, such as nutrition, movement, stress reduction, sleep restoration, provide the support, avoidance of addictive substances. So, all these components of lifestyle medicine can be set up into CORE
Mhm.
as part of your prehab surgery, prehab basically workflow,
Right,
you know. And that's the beauty of it. Like I said, it is useful for every healthcare professional. That's how we have set it up,
right.
making it very useful to all the disciplines.
Right, because I know you live very much in that lifestyle medicine, and I work a lot with bariatric surgeons or obesity medicine specialists, but it is something that's a struggle for bariatric surgeons, I know, to be able to track that effectively. Your patients are bringing in journals, or they're using another app and they're printing out things and bringing it in or trying to send it to you, but to have it all right there has really been so important and so effective. So that is awesome. If someone wanted to reach out to you, ask you some questions, or just learn a little bit more about what it is that you do, I know you're so active in the lifestyle medicine arena. How might they reach out to you?
So they can find me on online. My practice name is DuPage Dietitians. They can email me deepa@dupagedietitians.com. They can reach out to you and you know where to find me. Or just Google Nutrition is Deepa. I have YouTube channel which talks about lifestyle medicine, lot of recipes, etc. for your patients. And I'm pretty easy to find. So I'm looking forward to have some serious conversations with anyone out there who is either starting out, you may be a one person operation just thinking about lifestyle medicine, or you may be a mid level practice with plenty of patients, or a large organization and looking for a tool. I specifically want to talk to those who are just starting out. I cannot tell you the importance of having a right system in place from day one, how
Right.
important it is, and how much time and headache and how much time and energy and money you are going to save down the line.
Hmm.
So we are here to help. If
Hmm.
anybody, we are looking for some early adopters. If you want to try the system out, please reach out to us. I would be very happy to help you out.
Deepa, I know that you switched from a platform you used for quite some time into the Core LMP. Can you talk a little bit about that experience? Because we all know that that's not necessarily something that's easy to do.
Correct. So there we know that changing a system, there is a lot of inertia because we have had some experiences of in the past about transferring the patient data and the learning curve to start using the new system. But what makes it worthwhile is to have a system and a team which is going to help you grow if you are starting out and really make this process less intimidating while saving time and money and energy and improving your productivity. So, for the main reason for me to switch to another system was because I wanted to really have a lifestyle medicine component to my EMR capabilities. So having this together was the big drive for me to switch my patient data. That was a main drive for me to change the system.
Right. Thanks for sharing that. And how do you feel about it now?
I feel wonderful. I feel very efficient actually because I don't have to worry about emailing PDFs and printing PDFs and giving it to patient and patient doesn't know where it's gone. Now we literally have a very streamlined system and it saves so much time and improves the efficiency. So I am happy, my admin staff is happy, and of course, patients are happy because they finally have a home where they have all the necessary tools needed for them to make these supposedly simple lifestyle changes, but we know how hard they are with our work life balances and with our busy work life schedule.
Sure. Yep. Thanks for that. Awesome. Well, I know you're a very busy person. I really appreciate your time. Thank you so much. And to our listeners, thanks so much. If you haven't subscribed, please subscribe. And we look forward to having a conversation with you soon. Thanks, Deepa.
Thank you.